Now in this position, you put your head in the hand, so you prop up, right? Your hips and knees should be at about 90, so when you look at the film, you probably could raise them a little bit more, all right?
Yeah.
So 90 degrees is from your trunk to your thigh bone.
How's
right?
that?
Looks good. And then this is the first of 3 movements, and this is the one where you roll the upper body forward. Yeah, that kind of idea. And well, first just roll and see how far you go. You can use your left hand supporting on the table. Yeah, anywhere you want. It's not the head turning, remember? It's not head turning.
Okay.
It's shoulder and chest to come to the table. There you go. See now, is there a difference between this side and the other side?
Yes.
Big difference, isn't there? All right, come back up. So you just notice that.
Yeah.
And if you wanted to, right, and I'll just slide a pillow
Mm-hmm.
or whatever you want to use. Yeah, use that.
Might you be able to do with the other pillow?
Well, be real comfortable. The key is we want
Okay.
as much relaxation.
Okay.
Mm-hmm. Go ahead. That's it. And yeah, just besides the forehead resting on your fist, let the left elbow rest on the table,
Mm-hmm.
so it releases your shoulder. And the top leg is in line with the bottom leg. So you did fine, right? It didn't move. These are the cues that you're going to just pay attention to, because as you get lower over time, if the top leg is sliding over the bottom, that would be a substitution of the movement lower. We want it to happen in the mid-back. So in the position, it looks like you're doing nothing, but you focus on deep breathing, slow and deep breaths over time will happen the deeper you are able to have the body relax. That's it. And I would stay for several minutes in one position, and the neck should not be hurting you. The shoulders shouldn't be hurting you.
Hurts a little.
What, the neck?
The neck and the right shoulder. Really.
Okay, then come up, and with that information, let's add another layer.
Okay.
Okay.
Okay. What hurts less?
Okay, so you want to keep going towards less until we can get no hurting.
No hurting.
Yeah, what an idea.
Oh, we need more tight, I think.
Okay. So we added another layer, and you go by your symptoms. Ask yourself again, once you settle, give yourself time.
The neck is okay, no pain. The right shoulder, outer part of the right shoulder, lateral, got some discomfort.
Definite discomfort or some? Well, I didn't hear the word you said.
Yeah, definite discomfort.
Okay.
That's the shoulder.
And so as you lie here, say that your intention is to relax deeper.
Mm-hmm.
Does the shoulder become a little more irritated?
Less.
Okay, then it's okay to stay in the position. So that's the question you ask. Is it a little bit more? If it is, you would come out of it and support the shoulder under the armpit then. If it's again becoming less, then you could relax. Good. You spend several minutes like this, right? 2-3 minutes. Come out of it now. Very good. Now, on the bed, you won't have a problem, but because you're on the table, we need to adjust. All right, so take these away. So you're going to have to come in the middle of the table.
Yeah. Yeah.
Bring the arm so it lies on the crack, and you're that far because you got to roll back. Is the thing, right?
Okay.
So now in the second variation, you go ahead and you keep the hips and knees from moving, and you try to let the upper body roll back. Okay. Now, those ribs in the front where your hand is, you're just going to try to pull those down and roll the lower back now this way.
This way.
Yeah, so the pelvis and lower back rolls this direction while your upper back and your top shoulder rolls the opposite way. So your top shoulder is rolling away, and the belly is rolling this way towards us, towards me. Because the thing in between, right, between the belly and the head, that middle back, upper back, part of the neck, that's what we want to have giving. Neck won't be doing a lot. It's mainly the thoracic spine or rib spine. Again, check your symptoms. How does it feel?
Okay.
Good. Then you just deeply breathe and deeply relax. Again, several minutes. Now, if you don't have a lot of time, you spend a minute or two or a minute in each position, okay? But you just get it done. 5 days a week would be minimum, okay? All right. Then you come out of that position. So that's the end of the second. So realize that both the first and second position, the head is always in the hand.
Yeah.
So the third position is you no longer, you let the head lie on the arm. You can pause for a minute. So this is just transitional. This is not the third position. This is just transitional. You just relax, rest. And then when you're ready, you slide your top arm and shoulder out from underneath. Let the head go on the surface behind you. So in this case, it's the top arm is your left arm, so your left hand gets put behind your head, and you try to open the shoulder. So it's from the shoulder blade, right? Not just the elbow going back.
Yeah.
And you work the top leg stays in line with the bottom leg. That's where you can now take your right hand, place it on top of those lower rib borders, right? And pull, not with your hand only, but indicate with your belly muscles to pull that like you exhale down. Pull those ribs down now. Exhale. Use your, so right in here, you're going to exhale and use the belly to pull and then relax. And then pull down again. Yes. And then, So there's a movement. Yeah, that's it. Very good. Of the lower ribs coming towards your front of the pelvis, towards the hip, while the upper body is turning from the shoulder blade and the upper back. Okay. Notice that you're not torquing the neck or head. You know, everything's just moving really nicely. Good. All right. Turning. See if it's any different.
I think it is.
Oh, wow, yeah. Go the other way?
Yeah.
Holy cow.